Yes, ma'am.
Okay, I was curious. I don't believe in giving benefits to illegal immigrants either, but considering we have so many of them here, what would be your suggestions on if we suddenly took away Medicaid or any benefits for illegal immigrants? How would you suggest handling when you've got an illegal immigrant in a health crisis situation, heart attack or whatever?
Well, first of all, I would say I don't mean that we deny care. In other words, our hospital system has always been such that if you show up having a heart attack, you're going to get full care. I mean, no questions asked. Whether you're here legally, illegally, whether you can pay or can't pay, that's all dealt with afterwards. You get your care, and that's the way it should always be. I firmly stand for that. It's just that once the care has been rendered, the question then becomes, are we going to ask the taxpayer to pay for it, or will we ask the beneficiary of the care to pay for it? Many of these people wouldn't be able to pay all of it, but they could probably pay some of it, and some is better than none. But that's in the emergency situation. For more routine care, I think that it would obviously put more burden on people to pay their own way, and a lot of these people could actually come up with money for routine care. Routine care for the general population is not as expensive as we've been led to believe that it should be, because when we think of routine care, we think of $1,000 a month for an insurance premium, but really, this is not necessary for the care of most of the population. Most of us are healthy enough that we don't need $1,000 a month on average for our care. And by the way, one of the main principles for reforming health care for the better in America is to get away from this idea that everything we do, and it kind of goes back to what you said, that all of our health care goes through the insurance company. In other words, we should use insurance, whether it's public like Medicare, or whether it's private like Blue Cross or Blue Shield. We should really use insurance for catastrophic coverage or indemnity coverages as well. And for the routine care, we pay ourselves. It would lower the cost to you, the consumer, and to the taxpayer tremendously.
I have another concern is, and probably everybody in here has had this happen, when you are hospitalized or whatever, very often the insurance company goes ahead and pays the bill, and we as the patient never get to see the itemized bill.
Yes.
Whereas if we got to see our itemized bill, we could probably dispute a lot of the charges or question the charges that were on there.
Yes.
And that's another thing that would bring the cost down.
Absolutely.
Whether we're paying for it or an insurance company, I really believe that we have the right to see the entire itemized bill and to bring it up for dispute if we see discrepancies.
I fully agree. And this speaks to the greater issue of there's just too much of a lack of transparency in the whole system. It's just, even for me as a physician, it's very difficult for me when I see the billing statements that come back to me. It's very hard for me to understand them.
Right.
And there's just a generalized lack of transparency, so I agree with you fully. If you're the consumer in charge and you're looking at it line by line, well, did I really receive this treatment or not? No, they didn't do that for me. It would make a huge difference.
In one instance, my father-in-law was given Tums, 1 Tums, to counteract some other medication, and it's like $11 for 1 Tums.
I know, yes. Welcome to the modern world of healthcare.